name is Teresa Herrin. I'm a student at Lamar University working on advancing my degree in nursing. I've been a nurse since 1991. I work at the Hyperbarics and Wound Care Center where I'm certified, and recently I've been asked to instruct a facility on application of a multi-layer compression wrap. So today I'm going to talk to you a little bit about edema, applying a multi-layer compression wrap, and checking for overcompression. But first of all, I'd like to talk about edema. It's defined by the Mayo Clinic as a swelling in the tissues of the body. And it presents as the skin will look shiny and stretched. It'll appear to have water underneath the skin and the substructures. And when you press on these, it'll give a dimpled or a pitting effect. And there are many causes of edema. The first, some are trauma, also medications such as heart medications or estrogen therapy. And there are some things we never want to compress, such as deep vein thrombosis in the acute phase. So you always want to have the patient evaluated by a physician and then get an order for your compression dressing. Now the first layer that we're going to apply for our compression dressing with our demonstration is the cotton layer. And the cotton layer is used to absorb moisture and for padding and protection of the bony prominences. You'll begin your application just above the base of the toes with a 50% overlay and a 50% stretch. Proper placement of your dressing is important because it supports the vascular anatomy of the lower extremity and prevents further swelling. You'll want to go to just below the bend of the knee, 2 finger breadths, and this will help hold your dressing in place. You can secure it by putting a little bit of tape to hold your cotton layer in place. The next layer we want to apply is going to be our elastic layer, such as an ACE bandage. You're going to apply this the same with a 50% overlay and a 50% stretch. When applying this, you want to make sure that you have no wrinkles or folds, making it smooth, going from distal to proximal, all the way up to just below the bend of the knee. And you can secure this also with a little piece of tape. The next layer we want to apply is our cohesive elastic layer, which is Comm, and that's a good choice to use. And again, you'll want to go the same as the first 2 layers, just above the base of the toes, from distal to proximal, always working outward and inward towards the body. Again, this is for the vascular structures and to help reduce your edema. You want a 50% stretch and a 50% overlay, making sure that you have no wrinkles. You want to avoid any wrinkles that might cause a tourniquet effect, especially with Comm. When Comm tightens, it can cause a tourniquet effect. So you always want to monitor and evaluate your dressing. And it's like so. Always remember to elevate your extremity so that you don't have any further swelling in the tissues. You want to check your compression dressing by being able to slip 3 fingers into the top and 3 fingers into the bottom. You also want to check it by pressing on the great toe to make sure that it returns to pink within 3 seconds. And this is how you check for overcompression of your dressing. The patient always has to have his leg elevated, always monitor and evaluate, and we don't want to cause any further damage to the tissues or the substructures. So now you know the basics of applying compression dressing, and we're going to recap what we learned. First, we apply the cotton layer. That's to absorb and to protect the bony prominences. And next, we apply the elastic layer, and that's for compression. And third is the elastic cohesive layer, and that's for compression and to hold the dressing in place. Always avoid any wrinkles or folds to make sure that you don't cause a tourniquet effect, and keep the leg elevated to make sure there's no further swelling or tissue damage. So now you know the basics, and I hope that you're all able to make your compression dressing. So thank you for your time.